Thankfully, we've been able to connect with Dr. Mark Jadusi. Good morning, doctor.
Good morning.
How are you doing today, doctor?
I'm fine, thank you. And you?
By God's grace, I'm well. Thank you so much for joining us. And let's talk about Alzheimer's and dementia. Why is it that usually the two are mentioned together? If you could kindly take it one by one and explain, and then tell us why they seem to work together most of the time.
So, once again, good morning to all our viewers and listeners. And so, we'll be speaking briefly about Alzheimer's and dementia this morning. Alzheimer's disease is, in general, a condition that causes a progressive decline in your memory, how you remember things, or how you store things that have been in the past, in the brain, and then your thinking. So you have a decline in the way you think, and then also learning and organizing skills. How you go about your daily life. It's a brain condition that can lead to it. Eventually, it affects your ability to carry out basic daily activities. We usually will mention Alzheimer's and dementia together. But what is the big difference? Dementia usually will describe the state of a person's mental function. So dementia is not a specific medical condition or disease, but basically it depends on your mental function from a previously higher level that typically will be severe enough to interfere with your daily living before we call death. Alzheimer's is usually one of the common conditions that will lead to dementia, which is memory loss.
Okay.
So typically, it should be memory loss, reasoning, and how you handle complex tasks, or your language or your speech, ability to remember people and family and things like that.
All right, so let's look at the symptoms. I mean, I was trying to tell people that if you're constantly forgetful and you can't seem to organize your thoughts most of the time, you may be at risk. Could that be true?
It could be, but symptoms vary according to the patient and severity of the Alzheimer's disease. So it's usually we start with somebody losing memory or losing the ability to remember things, and then it will lead to the ability to also organize themselves, remember past things, activities of daily living, and then when it gets to the severe stage, they may actually will not even remember names, will not recognize family members, will not be able to. They actually will get lost, wander away and get lost because they cannot remember the day, the time, and even where they are. When it gets to severe stages, they will not even be able to eat well, they will not be able to do so many things, and eventually we lose them.
Doctor, me pacho, obet me aka twi kakra ma me. Aha, ni a wo kire mu no mi busa se so obi ye nya sa Alzheimer's bia. Ensankyerani be na dead onipa no wo kan asem a em se nipa bebre wo kan twi mu anka bebo aye mpa. Nti wada ma so obetumi asa aka ne be mu a ke be da wase.
Actually, into Alzheimer's is area the wunya wuntini enkara de papa. And it's affected usually and if you brain routine. Into Nama usually targets near if I say we daily living, which me any journey, which me sorry, which me kind idea, which me if you be in now kind of thing, okay appointments, you never did go with me, you know. So Alzheimer's, I will want a tip of it is initially just which me Africa cooking for your number. After went to me and kind you. And I said, oh, appointment to the I said, oh, back with here. 10 stage on a whole Kai of vanity. The time and that make some of the grandmother 80 above 80 years now. I've been the economy be something so we are fine back, about paying back. And I said, the never cry, the boy on Kaiser already. Your car or Casa, who be some question, I'll be beside this or I'm be beside you. and then so or air no person what kind so why is it obi so how back when the when you so for retirement no or so on about so I wasn't equation and I said what no I can't so on you be nti already it me affect you again with time no and my entire thing
apart from I refer we see a chance here hu nipa refer there e to that say untumi organize hu kra ye e dey biom na so obi e wo Alzheimer's and say wo ye nya bia ensusanso be na ye time there di wo
every 3 year one people also on words no they can't put words together into comedy mu be den aside from that ni sika stem ntini entry sika stem bio me medical help eco form nti ono ka sentini nya ne wo so timi ye na sensema bia ebesino na we and the man ya kan hasem da but nyama kititi ya wo so timi no ntini ye ka ntini da go bio the normal daily life it go hard if you need anything of it now sorry after the events and toilet me you know want to get you
who can say obi wo ho a
okay it go to me the phone to have an way to phone that and I said if you need about them to go here on kind of send this na phone again so this are no people want to send be say be fie no na ya den the go continue kind of and na be okay it is any mean na e kan ya ya
and yes ebia 77 preduas na dwuni mu ka no na mom Alzheimer's no na ya ne sa
Alzheimer's ya and about and then not doing a panel. Because there were different things. So why the most houses are not to me. About Alzheimer's, they are refused. Our own type of beer will feel
okay.
Due to damage in some of the cells inside the brain. A control Samuel man.
Why na bet to me anya sa Alzheimer's disease be?
Usually no. Most of the diagnosis started about 65 years. It's in 4 years. I started from 65 all the way up. The older you get, the severe the condition. But I think we are already 65 and being Alzheimer's.
Doctor, Doctor, yenchina mu yeni yemwa akra anasa abayu a obi a oye under 65 bia ntumi nya bi. Okay.
Until the baby early onset Alzheimer's.
Okay.
Next is before we symptoms never start, now actually a condition I started with that. I started the damage in a started. Boy, I think 20 years to cry and sign symptoms next year. Into boy had 35, 40, and that process not started. Now so you won't show any symptoms, which to me and you'll be there fine. If this is so hard, over 50 years, a problem not started. And your body is different. Into younger people can talk that it. Okay. The only thing is that severity, I am not a form. And you can be progressive. Into what I it takes so long and son of what that is show symptoms, So boy, I start 40, 50. It's better 70, 80, and son symptoms in the back. And I have other medical conditions which is so and it's basically increasing risk factors internal no say when you desire na and it's so increase your risk maybe it's hypertension a stroke when your car accident are affecting and that's diabetes any type of heart disease never be brain it's may affect the brain and the deal that may affect the more just to call it may affect your memory in the future. And as a family member, immediate family member, we have dementia, it is also a risk of a stroke attack.
All right, doctor, now say nipa no shase eyi san senchireni ye dia bibi o ha ebetumi ayama nana.
If I saw, I mean, number one, any family support. Ayana, you're paying for the 13 year, na they say, the year moment, we don't want to be around them, and I say, you're very classic, you're near almost better now, and to come but number one thing, family support, psychosocial support, mumpo be not in chain, morning in bon combo. Because I know that Alzheimer's by itself leads to depression and even health decline. It is a more dependent home. That's a more involved, no. More money here, more in the bomb for more in their own to more encouraging, meaning our and there are also men a do high, a bit near man, a reduced incidence, and I said a reduced progression. Usually, someone will be within 2 or 3 years, we do stage 7, and that's a stage out, but you don't even have a slow down process, And as a washer in your body, who's here, so what hypertension, I say, or diabetes, mom treated, or akumayari, mom treated, or stroke, misunderstanding, all those things help. And I say, we are overweight, and it's also one. So you reduce your weight, eat healthy. The main, some of the idea of pie, vegetables, fruits, and a way, definitely meat, who cholesterol, cholesterol, from Sunny meaning our Burma, Nipano, the progression of perform. But the main one is psychosocial support, family support, Muso, and then they'll be fine.
Doctor, what I said family support. Now you also mentioned psychosocial support. Can you please go deeper into that one, that psychosocial support?
Also, a minimum of Alzheimer's disease can also lead to depression and other mental illnesses.
Okay.
And it wasn't a proper diagnosis. One of the things we do before we even diagnose, they have very deep history. A running test video as to what is actually happening. And you say, "We buy our customer, I can make you when we diagnose them of Alzheimer's." But until you have maybe you're an idea, mental disease is so accountable. And so you need that support. You need the society. Sometimes even stigmatism. You go hard. The thing say, "Oh, when I was on the scanner, I feel be able to say, I'll be sending the man so back there." And no problem, no moving. So that support is very necessary.
Doctor, Obi, I send me a message on my personal line. Now, me person me kind. Now, or say, I beg your pardon. Or say, my mother-in-law, who is 63 years old, lives with us now in Accra. And she always complains to my husband that I don't give her food. Whilst I do, 3 times a day, I help her with her medications and all of that. But she still tells my husband that I don't care for her. Could she be suffering this disease?
It is possible, but it could also, for things like this, I always will I'll suggest that you go to her and ask her, how do you want me to treat you? And then you make that plan with her, because you go on now, percent your man is certain type of treatment at own, and that's the own.
Now, doctor,
so
also your money, mother-in-law, net Drianio. In fact, before God and me, I didn't want to say, before God and me, I give her food, I feed her and take care of her. But she always tells my husband, say, "Okay, you can say, oh man, Driani fitano pa unidi."
And so it could be dementia.
Okay.
It could be, but to really diagnose, I mean, here someone doctor actually my full history. There was most test there, just to make sure that all those things are properly diagnosed.
Okay.
So what's our problem now? If they are journey go on, a slow down process, but it has no cure.
It has no cure at all. You to mean, sir.
But
dementia
has no cure, but you can slow it down.
Okay. All right. Doctor, wait a minute. Question be book Ghana ha. What data be a chile 1 year 10 year dementia. A man in mema why pa ne 10 year dementia and Alzheimer's pa any dementia you know.
Usually global statistics, and in 9 or 3 times more compared to men. Just because usually they are not in any check environment.
Okay.
And because the more you age, the higher the risk. The statistics say that it's higher for women than men.
Apart from
we have,
channel, could there be other social factors that could lead to that? Be it stress and mad thinking too much, birth and all of that. Ni nyina to me I contribute and I say no na nya no kresa.
Correct. So there are social and environmental factors that can also lead to dementia and Alzheimer's. It being stress, it being a depression, it being a loneliness, and a few other environmental things where you work. So even so there are so many things that outside of the health or the affected brain direction can lead to dementia.
Doctor, 1 year tie Max TV anopay. So be say anopay bia wasema waka obi asema ma ne pa o. Ebi ni lady a o send bre me say ne mother-in-law man aduane pa nso nukunu fra adwuma ba o si fra no pa o ni di ye. E bia na obi enipa bi enso so go through that. Apart from say ye de ne be ko hospital a bia be hwe ne eye nipa no adien biom na nipa ne betumi aye to wrap up.
The key thing is people also need to see what is really wrong. They can open up to you that this is what is happening. And once that is determined, then you look at the other problems around it. I always say to manage most conditions, you have to look at the root cause. If you feel AC and they do any pneumonia, you fix it. So BP and and diabetes. Aside from that, the main thing is that you show them love, and then prevent the risk factors.
All right, Dr. Mark Dosi, or your clinical medical, if anything, specialist, pharmaceutical specialist, pharmacist and specialist, or lecturer. Now, Doctor, any person, any fan I will lecture no.
Me a lecturer at Central University and at University.
Okay.
But me a head of pharmacy and pharmaceutical services or International Maritime Hospital. The main Ejimaya Hospital, and I'm a coffee of Pachard. And then you see, you're sent to any specialist or high master.
All right. Okay, so we have a question for you from one of our viewers. Doctor, before you go, 3 siblings. Their mother is quite a very difficult person, and she gave their big sister a hard time so much. Say, so femunya BP ni ade we, and say no. Although she's old, she's still very strong, uncontrollably. She gets angry, and does all those things. Say why you be when you na ni so she okuntokwa. Say kura say owu amomu nsi na yiase and all of that. Nka omo pa che say nka onyini na wo so oba form. Omo question omo busa wo ni say ono so betumi yare we bi betumi e de nipa no akwawie sa na.
So wow. One of the things that happen with dementia is irritability and aggression. Because before then, they were fine and they were able to perform their kind of activities of daily living. It's nearly be there, but now there is that limitation or try to obey so continue. It's me manier frustrated, it's me manier very aggressive, it's me manier near. So it is them understanding her. Then it's easier for them to cope and manage with her.
Doctor, how do they cope with a mother who is physically, verbally, and emotionally abusive and would always want to attack, literally? How do they go about it? If we understand it, how do we, is it that we need to take care for medical care and all of that? Apart from that, what else do we do?
It's a very difficult thing, I have to admit.
Yeah.
But doing what I do and what I've been used to, especially from my training in the US, they start with showing love. They do how you can't actually, to be honest with you can't fix it.
Yeah.
Sometimes you just have to let them go through the process and they will cool down. People also, you try to talk to them nicely. You let them know that you understand how they feel, but you are there for them. So you don't hate them. And people have just some of those small, nice talks, and then showing love will let them cool off. It is when when it gets to a certain level, then you have to take them to a facility where we can actually either put them to sleep or give them medicine to calm down. So there
Doctor,
are
what's the
different ways to manage it.
Facility bang.
Usually, now also we pet doctor we need idea how to manage it properly. Some of these doctors who are specialists, a regular medical officer may not be able to do it. You must have proper training in management of such people. Into a facilities people, there are specialists around, and it's good to actually look for somebody who understands. And I have to say this since I'm on radio, said what I've seen locally is that sometimes the way we treat or manage our people who have mental diseases is a little different from what is best practice. That can actually make them more depressed and make them worse off than we are supposed to tell them. In Tinyamas, it's unfair, I was a young but which more dog and even the way you speak to them. One of the common things that I always train in college students are there. I tell them, say, first, Obiba, so you are depressed. Then you are depressed with you. Obana say, we have schizophrenia, and I said, well, yes, this is a medicine that will stabilize your brain. The normal is stable. So this is your mood, the medicine that will up your mood. One can say why depressed. So so that you can also give them some dignity. So the way we manage and treat the people who are in our lives, especially the mental conditions or brain conditions, it has changed a little bit. Where we show more love, we work with them, and then we also even give them a chance to make inputs and how they should be managed. I also want to get chance to send a million at the amount. So we say, and I say, oh, by you say, what the bar usually there will be peace. So hard, let me say it. Or better say, you say, what the bar still and but you just have to understand that that is what the phase they are going through, and you can't change it. And you just have to tolerate, and then crack, and then they'll be okay.
Doctor, answer now, Bekono. Wait a minute, another question, man. Sana wako. When Kayadianka, if we had friendly mental health facilities where it's a beautiful edifice. We're not talking about huge man, but the whole place is beautiful. It is welcoming. Who say ya painting or come flowers, who gardens, who mental facilities what Ghana. Nipanunka you bet to me and Nantia Komu cry with this person. But our mental facilities in Ghana look like asylums.
Yes.
As a titi 19 Deben escaped to Sobi Boy. Asylums nibi. And we're in 2024 and it still looks like that. Mijidi sa wudi wanu betum kakra bi ansana ye ni waka bye.
I'm hoping that with time, things will improve. And then they will say almost a new building.
Yeah.
I'm hoping that they'll move in there and then also make it one of those best practice facilities. There are other people to that, or there are other places that they are also looking to upgrade. It's in a vampire with time now. Ghana will make that one of the a priority to also provide a very good environment. There are some private facilities that also can take care of these patients. Yeah. We are not a big facility for it, but we do have a specialist and a clinic that manages some of these conditions. And those who know International Maritime Hospital, Omni Hospital, but you get the best care here. That I can guarantee you.
All right.
The customer service is
okay.
So these, and then I know there are other facilities in town that can take care of this people. And let's look into it. I think as a general public, to what we demand is usually what we will get. And if some of these things are not going well, we should actually talk about it and make recommendations.
Dr. Mark Jadosi, for your danasi peace, and pay, wabaka ye home, and any didn't come for Alzheimer's disease, any dementia home. No, I say Alzheimer's, no cry, and in could be dementia. Who do dementia, not as a real Phoebe, and if you cry now, only ye, now quite a sebi, near as a wajunimu account cacran, not some more kaya, near me, Dennis say. In some work can you answer who so be uni obi to my no papa be una na be no ye no ma bisa na o se fa ne ko hospital na ye betumi amani nura ebebre saade na se ye tu ase kura nya yie but ebebre na se o se say wutu wana re fifi no ma enketenkete o ko hospital ya ka kire doctor e bi o ho aye kwan bi so ebeboa ebe ma medications bi ebebre na se a wonni 60-65 ukọ no ha wo bebre o se ebi nsumo die no die ne den o se aggression eni den ni ntokwa eni obi kura to me born in medua ni those things o se ni nyina ye bia ya me enfa nye nyina na ye de be hye demons ni ade o se ni nyina ye sa Alzheimer's disease no ebi wo ha the aggression pa na eba o se obi wo ha se sebe woni ni tena kasa kama o ma na aduane di wo krokro ni se dien o se enye yie nti ni pasa na akodru se wo de ne be ko hospital eto da ebeji wo ato ho kakra na yaboa wo nyesa ebi ana wakopra obi nti wahunu se sabrewa bi no wo fie ho a na se edua bi da ne nti obi ba no pese di dua ne bono na ebi so ebaifo ni those things ni nyina ya na answers wo ho Ghana yenti bibi ase ya na de akoshe demons asofo nso bi nisremo asofo ni bi so mwa ya oyabrewa sikani anka onye baifo oyabrewa hiani a oyebeye adai money no wa kekan bibi enti ase ami mani enti se wo pese wo san etie bi mu obetumi akọ Facebook Max TV on Facebook no wakoto obo no watie ni ye obetumi so akọ YouTube Max TV Ghana no wato obo no watie ni